Hello everyone, I am going to demonstrate the Odoo healthcare management system. This system involves the configurations for healthcare procedures, appointments, inpatient administration, patients, lab tests, nursing, pediatrics, invoices and medical services, and reporting. First of all, we need to do some initial configuration for the healthcare management system. So let's see all the configurations required one by one. In the configuration tab, we can see the first configuration is for laboratory. We can see here there are 17 lab testing units created. The user can create a new lab testing unit by clicking on the button create. The next option is new type of lab test. There are 18 lab tests created previously. The user can create a new lab test by clicking on the button create. For diseases, configurations required are like for diseases we have a pre-configured list of all the diseases. 14,183 diseases are there which are as per the ICD-10 standard. Then we have new diseases. The user can add a new disease type from this option. For pathology groups, we have configurations like the name, code and short description for the pathology group. The user can create a new group by clicking on the button create. There are some categories required for diseases. Here is the disease category structure. You can see here it's the structure showing all the diseases, and for creating a new disease category, the user can click on the button create and click and create the new disease category. Then the next option for configuration is medical procedures. This is the list of all medical procedures previously created. The user can create a new medical procedure by clicking on the button create. Then there are some configurations related to health centers, such as creating centers, buildings, units, wards, beds and some operating rooms for the respective health centers. The operational areas can be created from this option by clicking on the button create, and operational sectors can be created by the button create. You can see there are 2 operational sectors already created. From this option we can create different physicians. Here we can see the physician data is created. If you want to create a new physician, you can click on the button create and create a new physician. We need to enter physician name, specialty, his institution and his ID number. The master configurations related to medicaments is shown here. We can configure different masters related to medicaments from this option. For example, medicament list is shown here. We can create a new medicament from this create button. Then medication dosage frequency can be created from this button. Similarly, we can create medicament dose units, medicament administration routes, medicament form. This is the medicament category structure, and we can create medicament categories from this create button. We need to enter category name and parent category here. Then we can configure insurance company and different type of insurances from this option. Then the next configuration is for genetic risks. This is the list of all genetic risks previously created. We can create a new risk from this create button. Then next configurations are medical specialties, occupations. Different occupations are here already created. We can create a new occupation from this create button. Then we have created some ethnic groups. Recreational drugs list is here. We can create a new one from this create button and enter all required fields for creating the recreational drugs. After doing some initial configurations, here we can create new patients. This is the list of patients created in the system. We can create a new patient from this create button. Here we need to enter some details related to the patient, and such as patient name, patient ID will be automatically generated. We need to enter his date of birth, sexuality, his picture, and some other information such as general information which has blood type, ethnic group, address, marital status, etc. Then we need to enter his diseases information here. Medication information under this option. We need to enter his appointment details from this option. Then all other information such as lifestyles, surgeries, genetic risks, socioeconomics, and some data related to his lab test will be shown here. Then we can see the prescriptions under this patient option. This is the list of prescriptions created earlier. We can create a new prescription for any patient by clicking on the button create. Here we need to select the patient ID, prescription date. Then we need to enter prescribing doctor, pharmacy, invoice exempt, invoice status, and we can add some information related to prescription such as medicament dosage, common dosage, specific dosage, and other information. This option shows patient hospitalization administration details, which has all the details related to patient such as his registration code, patient name, hospital bed, hospitalization date, and some other information. Then in nutrition tab, his nutrition information can be seen, his medication information, care plan, and ICU information can be seen in this tab. Other patient information can be seen under this option, patient ICU info, GCS, then ECG, and then Apache 2 score. So this shows patient's information in different sections. The next feature is lab test results. In this section we can see the lab test created in the system. New lab test can be created from this create button. The lab test involves the information such as test ID, test type, date of the analysis, patient name, physician name, and the date requested, and other information related to the test can be seen here. The physician can enter the numbers as per the performance of the patient in the test. This lab test data can be printed from this print button. This shows the PDF format of the lab test data, which can be printed. The next option is nursing, where we can enter information related to patient surroundings. In this option we can enter this data, then ICU information, procedures, medication, and stop moves related information. Then we have patient's ambulatory care information, where we can enter the information which is related to the patient's ambulatory care. Then the next feature is pediatrics. Under that we have the option newborn, where we can enter the details of a newborn baby. This shows various information about the baby neonatal signs and symptoms, neonatal reflex checks information, and some other information related to the newborn baby. The next option is Pediatrics Symptoms Checklist. Under this checklist we can see different checklist options. The physician needs to select the appropriate option and the respective score will be calculated for the patient. Then the next feature is Invoices. Under this feature, different lab tests, appointments and patient prescriptions can be invoiced from the button Create. The next option is Medical Service, where we can create the information related to medical service such as ID, description, patient name, date, then other information such as description, the product for medical service, quantity and the date. The next feature is Reporting. Under this feature we can see various reports. The first option is Medicament List. This is the medicament list which is already pre-configured into the system. Next option is Appointment Evaluation per Doctor. We can select the name of the physician, the start date and the end date, so it will give you the appointments scheduled between that date. Then the next option is Appointment Evaluation for Medical Health Services. The next option will show the appointments as per the prescription set by the physician, so we can select the physician name and the date range. Next option will show you the appointments as per the specialty selected and the date range, so all the appointments between that date can be shown on the screen. In the next feature is Reporting. Under this feature we have first option Medicament List. This is the list pre-configured into the system. Then we have the next option Appointment Evaluation as per the doctor. Here we need to select the name of the physician and we need to select the start date and the end date. It will display the list of appointments between the dates selected. The next option is Evaluation as per Medical Health Services. Here we need to select the start date and end date, so it will display the list of appointments for that. Next option is Appointments Evaluation as per the prescription, so we need to select the name of the physician and the start date and end date. Next option is Appointments Evaluation as per the specialty selected, so it will display the list of appointments between the start date and the end date. Thank you for watching the demonstration for the healthcare management system.